for these cancer patients, usually it's a better idea to go to ovary tissue freezing. And often for women that just have personal reasons, they prefer that. So the basis of this is that all of the primordial follicles, that is, the immature eggs that are going to mature 1,000 at a time every month in any woman, are located in the outer 1 millimeter of the ovary. It's just in this outer, thick, fibrous, not the thin, fibrous cortex. And nothing inside the ovary is of any significance. The inside of the ovary is just a soft little receptacle with blood supply, and where the follicles can begin to get bigger and bigger going inward to the soft tissue before they become mature and then explode through the surface and ovulate. So all we care about is what's on that outer surface, and it's very tiny. So you can treat it like a skin graft. We can just put it right on the surface of the dead ovary. We can cut off the old dead cortex that has no eggs in it, and we can just put it on there and suture it just like a plastic surgeon would. A skin graft. It works just like a skin graft. And lo and behold, it's like magic. In 4 months, they're ovulating and menstruating, and these little pieces of tissue can last 7 or 8 years, really. And then you have a lot more frozen tissue still in the freezer, so that if they do run out of eggs, you've got more. We tell them, we'll do this procedure tomorrow, and you'll be ready for treatment 2 days later. So that has a big advantage over egg freezing, where they have to go through stimulation cycles, and then they still only get maybe 10 or 15 eggs. This way we'll get 200,000 eggs. I mean, there's just a total difference. It's a paradigm shift. It's dramatic. And so we'll just take out an ovary from that cancer patient through a little tiny incision, and she goes back to the recovery room 15 minutes later, and it's an outpatient procedure, and 2 days later she can begin her cancer treatment without any problem. And then we cut off all of the inside, which isn't important, I mentioned, and we just take that outer cortical strip, and we cut up multiple strips of it, and we freeze it just the way we would freeze a skin graft, and they freeze very, very well. With vitrification, they freeze even better than with slow freeze. We don't lose any eggs at all. And then they can come back 5, 10, 15, 20 years later, have that little strip of tissue put back on top of their denuded ovary that's already been killed by the chemotherapy or radiation, and all of them work within, I mean, it's very robust. Within 4 months, they're all ovulating and menstruating, even though they've been menopausal for the previous 5, 10, or 15 years.